So, for one thing, in a recovery oriented system of care, what we're trying to do is to achieve the outcomes that the person wants, but also the kinds of outcomes that are focused on the person having a meaningful life in their community. So, what that means is that when we're working with people from a recovery oriented framework, what we're trying to do is ensure that we're using evidence based treatment approaches, that we are listening to the person, that we are addressing issues that we know impede people from achieving long-term recovery in their community. Another aspect of recovery-oriented care is that it shifts the why, the what, and the how of treatment. The why being we are focused on what the person wants. The what is that we are incorporating both clinical strategies as well as non-clinical strategies that help the person achieve long-term recovery. And very importantly, the how is that we do that in partnership with the person. And so in a recovery-oriented frame, we are not the professional expert that is providing advice to the person, but we're a partner who is helping the person navigate their illness and to navigate, more importantly, their health. I think it's enormously important for graduate programs to incorporate recovery into their curriculum and really as a framework for how they teach graduate students. As a commissioner for a very large behavioral health agency, we literally spend hundreds of thousands of dollars each year retraining practitioners who are coming into the field to work with people who have both substance use and mental health challenges. The reality is that it would be much more efficient for us and much more effective for people to come into the field with that framework. The healthcare industry is moving to that way of thinking in terms of healthcare in general. That is, being person-centered, being focused on outcomes, using evidence-based practices. And for those of us who manage public systems and private systems, we need practitioners who are really prepared for that kind of environment. I think that the APA recovery curriculum is a tremendous asset to the field. For many years now, the idea of recovery has been emerging as a framework, and organizations and systems have had to take the ideas, the concepts, and then to translate them into what does that look like in practice. What the curriculum does is a couple of things. One is it gives you the historical background on recovery. How did we end up here in terms of thinking in terms of recovery for service delivery? It gives you the research basis for recovery, and it gives some real practical advice and information about how to practice recovery-oriented care. So it really does all of the work for you. And more importantly, it provides in a very systematic way both the framework and the strategies that can be used in delivering recovery-oriented care. I believe that recovery-oriented clinicians are going to be enormously valuable in the healthcare environment. First of all, I think that they're valuable now because for those people who are trained in that orientation, they are working towards the kinds of outcomes that people want to get for themselves. They are also valuable for people like me who are public payers and have to be concerned about the value that we get for each dollar that we spend, because I know that those clinicians are helping people achieve outcomes that are not only the outcomes that the person wants, but they're the kinds of outcomes that save us money in the long term. More importantly, what is happening in healthcare is that we're moving from a fee-for-service environment to an environment where practitioners and healthcare organizations are increasingly going to be paid based on the outcomes that they're achieving. And so practitioners who are coming out and are oriented that way are going to be very valuable, not only to behavioral healthcare organizations, but to healthcare organizations, because one of the things we know is that one of the major drivers of healthcare costs are untreated behavioral health conditions. And so these practitioners are going to be enormously important to the healthcare environment, and they're going to be extremely marketable in the near future.